Hey, this is Dr. Rutherford here. Happy New Year. And 2020 is now gone, thank God. And I'll get into that a little bit. You know, some of it's a little bit of a thank God. For us around here, it was a little bit of a blessing in certain ways, even though it affected us like it affected everybody else. But we here had a lot of good things happen because of, probably I could almost say because of the COVID situation. And 2021 is looking pretty good as far as our goals and what we want to achieve. So 2020, everybody's rolling their eyes. COVID, those of us who are on the West Coast, it was COVID, it was the elections, and it was smoke. Okay, lots of smoke here on the West Coast, and everybody had their challenges weather-wise this year, but the smoke really was a killer, and it just really altered the way we had to take care of our patients because they were all coming in so toxic. It was just an insane year. Obviously, stress played a humongous part in what we were dealing with last year, and we'll see what happens this year relative to the national stress. I don't know if that's going to go away real soon, but that was a huge player. I used a lot more adaptocrines and ashwagandhas and stuff last year than I've ever used in all my years before put together to keep all of that under control. And but you know what it did? It did force us to rethink what we were doing last year. So it turned out to be really good because it was a year in which we really looked hard to see how can we screw this down, how can we make the testing more efficient and effectively economical, how could we do more things to move cases along better, maybe have more improvement in a quicker period of time. And we were actually able to accomplish all of those things last year. It was quite remarkable. We're now seeing patients we're getting results now in the first month that it used to take us 5 and 6 months to get, because we've taken, as you know, I always give acknowledgement to my mentor, Dr. Karazian, and he just keeps coming up with new stuff and thyroid but this year for me, big breakthrough was blood sugar. We talked a lot about thyroid this past year. We really went into thyroid and Hashimotos, and that's really worked out well for me because I feel like I know it really well, and it was nice. We got a lot of people who called to ask me if I would consult with them. So we got a lot of interesting cases. I was able to even expand my knowledge on that and understand it even better. Dr. Crosden's always coming up with new stuff. This was the year that I decided that blood sugar was probably something I needed to delve into deeper. It just had that feel like blood sugar, there was more to it. And indeed there was. Of course, I went to a Dr. Crossing seminar, and indeed there was so much more to it than I had been aware of, and it was game changing. So last year was really Hashimoto's. This year we're going to be talking a lot about. We're going to be still doing Hashimoto's, but we're going to kind of morph a little bit more, kind of hark back to where it all started, which was fibromyalgia back years and years and years ago. That's what we started with when I got into this. And we're probably going to be talking a lot more about blood sugar. And like there's like 7 levels of blood sugar. It drive me crazy. People would come in here and they'd have every blood sugar symptom that there was. I would know it was part of what was causing their anxiety and their panic attacks. And I know it was what was flaring up their thyroid, but all their numbers were normal. Well, you are all familiar with that relative to Hashimoto's, right? Or thyroid, all my numbers. Well, guess what? A lot of you have hypoglycemia and or insulin resistance, but your numbers are normal. And it would drive me crazy because I knew it was there. I would treat the person as having it. It would help, and I would just think there's more to this. Sure enough, there's ways to figure that out. there's prediabetes, there's metabolic syndrome, there's insulin resistance, there's functional hypoglycemia, there's reactive hypoglycemia, there's all kinds of hypoglycemias, and then of course there's something called late adult onset diabetes. It's everywhere, but it's something a lot of you probably are suffering from but don't know it. And then there's just diabetes type 1. So I mean, and all of these things play into chronic conditions, hugely in the chronic conditions. Some of them some of that blood sugar plays into the one person who comes in here and everything gets better, but their hair is still falling out, or they can't lose weight. So that's going to be something we're going to be talking a lot about this year. I don't think anybody's getting their blood sugar taken care of correctly, and I don't call giving people 3 drugs for diabetes type 2 taking care of it correctly. Not to be, anti-medicine, but I'm just saying that's to me doesn't have to happen. And so we're going to be talking about that this year, and we're going to be talking about weight loss, and we're finally going to be talking about weight loss because I finally think I understand it better. And truly, most of the people who contact us and we get treated for thyroid, blood sugar, gut problems, fibromyalgia, chronic fatigue, most of them lose weight. And frankly, the patient will be saying, you know what, I've lost 35 pounds. And I'm like, yeah, but is your hair stopped falling out? And, and is your pain going away? And is your fatigue going away? And they're like excited to tell me about the weight loss. I'm like, oh, yeah, that's okay. But I started to focus in on that more because there was a percentage that didn't lose weight. And you could get all their fatigue gone, you could get their irritable bowels gone, you can get their skin better, their hair stopped falling out, but if they didn't lose weight, they think you stink. they just do. It's just like, it's stressful. So the thought of going into weight loss was a little intimidating for me, but again, I started learning more about blood sugar. I started learning more about a lot of other things that will cause you to not lose weight, things called POPs, which we're going to talk about. So we're going to talk about weight loss this year. We're going to talk about weight loss. We're going to talk about fibromyalgia. We're going to talk about more about Hashimotos. And these are the things, and blood sugar. So that's going to kind of be where we went last year. And truly, we now have a unique product. We have a unique weight loss product. We have a unique blood sugar product, and we have a unique product for chronic conditions because we have now been able to figure out how to work these cases without having to have people come here and evaluate them. And that was because of COVID. COVID said, no, we don't want people flying all over the place and doing stuff. So we started changing our consults a little bit, trying to get data out of it that we normally would get from an exam. And we were pretty much able to get it with the cooperation of the patients. And we were able to put that together with a couple of different protocols. I have a couple of colleagues who have put some supplements together for inflammation and for detoxifying. But it turns out, in reviewing it, that they're pretty effective in helping with autoimmunity. And so they've been trying to get me to do this for a couple of years, at least 3, 4, 5 years. I can't remember when we had our interview with them. And I just got to thinking about it, and I thought, if we put that together with some of this stuff over here that I've learned from this area and that, and we do this, let's say maybe all at once up front, depending on what the person's blood labs would say and depending what their food sensitivities. That's another thing we'll talk about, is food sensitivities. Let's see what happens. And we've munched these together. We fine-tuned our intake protocols. We fine-tuned our evaluative procedures, and it's working. We are getting patients to improve. We're getting a higher percentage of patients to improve. They're improving faster. They're improving with overall less supplements. And so when I referred in the beginning to last year being kind of a good year for us, it was kind of like a good year, kind of like a pig going through a python. I was being the pig going through the python, just trying to figure this out, and getting kicked in the teeth here and there, but it's really, in the end, it's worked out to where we kind of have a new logarithm. We kind of have a new protocol that is really kind of blowing our minds around here as to the physical changes and the symptomatic changes we're seeing, and just so many of these mystery disease types of cases. So we're going to be bringing that to you this year. And we're going to be talking about those, and the things we're going to be talking about with weight loss, the things we're going to be talking about with blood sugar, other things that we're going to be talking about with diets. We no longer use one diet. And we've learned how to evaluate a person, because most of you come in here, you've tried all the diets, right? And we kind of got that. At some point, we started to get one diet wasn't really working as well as we'd like for us, even an autoimmune paleo diet or low FODMAP diet or the whatever diet, or the crazy diets, the elemental diets, or all those types of things. So Dr. Kettering's working with me now with diet. He's been handling diet, and we've spent probably a good year and a half really grinding down on diet. And we're finding that we usually need to combine 2 or 3 diets. And you've heard me say, if you don't get the diet under control and you don't get the food sensitivities under control, that's been another big breakthrough for us. We have figured out how to better use these food sensitivities tests to be able to get that diet implemented properly for that person usually within 2 weeks, sometimes 3. It's no small task. I'll talk about this sometime this year as to how that goes, because you don't get the diet under control in the beginning, you are going to fail an enormous amount of the time with the types of cases that tend to find their way to this office. And then we've had a lot of fun this year. We just had a lot of people contacting us this year. So relative to our videos and asking us to do presentations or talk to groups, and that's been kind of fun. For us, the COVID thing hit us hard like anybody else, and it certainly changed our overall operations. But it did force us, kind of gave us the motivation. People were having a hard time last year, and people still are having a hard time financially. So it gave us the motivation to try to squeeze these things down, but yet still get the results that we used to get. And frankly, we've exceeded that at this point in time, at least in our world. And the results, we actually have a motto around here that we haven't used in a long time. It's called "The results speak for themselves." I was very careful about using that last year until we started figuring this stuff out again. But I kind of like that, results speak for themselves. Very catchy, right? But that's where we're at. That's where we're at. I think, I'm kind of excited about 2021. Who knows what's going to go on with all of the ongoing things with the politics, as well as the COVID, and nobody knows. I mean, I know we got a lot of experts out there that seem to disagree with each other a lot. So I think we're just taking that one day at a time. Maybe at some point I'll tell people what I think to do about the COVID thing. I like to keep low key on this, but we have things that we use here for us, for our family, for our staff, and for our patients who become patients. And who knows, maybe we'll talk about that a little bit this year too, if it becomes necessary. And that's it. We had a great, we really feel like we were able to use the adversity to take us a step further as far as understanding the overall landscape for Hashimotos, for sure. Okay, but chronic conditions in general, just literally chronic physiology in general. How do you attack it? What's the best way to attack it? What's the proper hierarchy? How do you do a better evaluation? So it forced us to do that. It was a lot of work, but I think it's going to pay off great dividends for a lot of people in the future. So looking forward to this year. Those are the things that we're going to be presenting this year. If you have any ideas or you have anything within the framework of all that, and go, hey, Dr. Rutherford, what about this or what about that? I'm always open. I'm always open to subjects. I'm looking for subjects that usually generally apply across a board, not to just like one narrow, group of individuals, but I'm interested in whatever you have interest in, and I'm always open to taking suggestions for topics. So that was last year. That's gonna be this year. I'm really looking forward to it, and I am appreciative of all of those you who have sent us the emails and told me how much some of these things have helped you so much, and for some of you couldn't come in, or you couldn't contact me, or you couldn't do whatever you wanted to do, but that the data that we gave you helped you, and you were able to piece things together, and you were doing better than you were doing before. That's what I want. That's what I want. That's what I want to hear. And so hopefully we can continue that this year, and continue our relationship, and maybe have some fun this year. Okay. All right. So until next time, Dr. Rutherford, take care.